Welcome, guys. Welcome to the podcast for Dr. Jimenez and crew. We're discussing today metabolic syndrome. We're going to be discussing it from a different point of view. We're going to try to give you really good, useful tips that can make sense and easily doable at home. Metabolic syndrome is a very vast concept. It contains 5 major issues. It has high blood glucose. It has belly fat measurements. It has triglycerides. It has HDL issues. And it pretty much has a whole conglomeration of dynamics that have to be measured in. The whole reason we discuss metabolic syndrome because it affects our community very much. So we're going to be discussing these particular issues and how we can fix and how give you the ability to adapt your lifestyle so that you don't end up having. It's one of the most important disorders that it's affecting modern medicine today, let alone once we understand it, everywhere you go, you're going to see a lot of people having metabolic syndrome. And it's part of a society, not something you see in Europe as much, but in America, because we do have a lot of foods and our plates are usually bigger, we have the ability to adapt our bodies in a different way by just what we eat. There's no disorder that will actually change so quickly and so fast as a good mechanism and a good protocol that will help you do with metabolic disorders and metabolic syndrome. So having said that, today we have a group of individuals. We have Astrid Ornelas and we have Ken Avon that are going to be discussing and adding information to us that can help us through the process. Now, Ken Avon is our health coach. She's the one who works in our office that when I'm a practicing physician on physical medicine and when I'm working with people one-on-one, we have other people working with dietary issues and dietary needs, and my team here is very, very good. We also have our top clinical researcher and the individual who actually curates much of our technology and really is at the cutting edge of what we do and our sciences. It's Miss Ornelas. Miss Ornelas, Astrid, as we call her, she's really ghetto with the knowledge. She gets really nasty with the science, right? And it's really, really where we are. Today, we live in a world where research is coming and spitting out of the NCBI, which is the repository, or PubMed, which people can see. We use this information and we use what works and what doesn't. Not all information is accurate in PubMed because you have different points of views, but when we have our finger in it's almost like finger on a pulse, we can actually see the things that affect. With certain keywords and certain alerts, we get notified of changes for, let's say, dietary sugar issues, with triglyceride issues, with fat issues, anything pertaining to metabolic disorders. We are able to kind of come up with a treatment protocol that is live, adaptive from doctors and researchers and PhDs around the world almost instantaneously, literally even before they're published. For example, today happens to be February 1st, for example. It's not, but we'll be getting results and studies presented by the National Journal of Cardiology that are going to come out in March, if that makes sense. So that information is early, hot off the press, and Astrid helps us figure these things out and sees, hey, we found something really hot and something to help our patients and bring the N equals 1, which is a patient and doctor equals 1, a patient and therapist equals 1, that we don't do specific protocols for everyone in general. We do specific protocols for each individual person as we go through the process. So as we do this, the journey of understanding metabolic syndrome is very dynamic and very deep. And we can start from just looking at someone all the way to blood work, all the way to dietary changes, all the way to metabolic changes, all the way down to the cellular activity that's actively working. And we measure issues with BIAs and BMIs, which we have done with previous podcast, but we can also get into the level of the genomics and the changing of the chromosomes and the telomeres in the chromosomes, which we can affect by our diet. Okay, all roads lead to diets, and what I say in some weird way, all roads lead to smoothies, okay? Smoothies, because when we look at smoothies, we look at the components of smoothies and come up with dynamics that are actually abilities to change. Now, what I look for, and when I look for treatments, I look at things that make people's lives better, okay? And how can we do this? And for all those mothers, they understand and they may not realize that they do this, but a mom doesn't wake up saying, I'm going to give my kid food. No, she's kind of doing a mental lavage of bringing the whole kitchen because she wants to literally infuse the best nutrition for their child and offer their best kind of options for their baby to go through the world, or through daycare, through elementary school, through middle school, through high school, so that the child can actually develop well. nobody goes out thinking that I'm going to give my kid just junk, and if that's the case, well, that's probably not a good parenting. But we won't talk about that. What we will talk about is good nutrition and how we can adapt those things. So I'd like to introduce Kenna right now, and she's going to be discussing a little bit of what we do when we see someone with metabolic disorders and our approach to it. So as she goes through that, she's going to be able to give an understanding as to how we evaluate and assess a patient and bring it in so that we can start getting a little bit of control for that individual. Kenna, it's all yours.
All right. So first, I just want to talk about the smoothies a little bit more. I personally am a mom, so in the morning time, things get crazy. You never have as much time as you think you do, but you do need that nutrients, and so do your kids. So I love smoothies. They're super fast. You get everything you need, and most people think that when you're eating to fill your stomach, but you're actually eating to fill your cells. Your cells are what need that nutrients. That's what carries you on with the energy, the metabolism, all of that. So those smoothies are a super great option, which we definitely give our patients. We even have a book that has 150 smoothie recipes that are great for anti-aging, helping diabetes, lowering that cholesterol, just controlling inflammation, things like that. So it's definitely one resource we give to our patients. But we do have multiple other options that we have for the patients that come in with metabolic disease.
Before you go in there,
Yes.
Kenna, let me just kind of add that what I've learned is that we got to make it simple. We got to take homes or takeaways. And what we're trying to do is we're trying to give you the tools that can help you in that process. And we're going to take you to the kitchen. We're going to grab you by the ear, so to speak, and we're going to show you the areas where we need to look at. So Kenna's about to give us the information in terms of smoothies that will assist us along with dietary changes that we can give our families and change this metabolic disaster that affects so many people called metabolic syndrome. Go ahead.
Okay. So like he was saying with those smoothies, one thing that you should add to your smoothies, I love to add it in mine, is spinach. Spinach is a great choice because it gives your body more nutrients. You're getting an extra serving of vegetables, but you can't really taste it, especially when it gets covered up by the natural sweetness that you find in fruits. So that's definitely a great option when it comes to the smoothies. But another thing that Dr. Jimenez was mentioning is other things in the kitchen. So there are other substitutes that we're kind of wanting our patients to use and implement them. You can start small and it'll make a huge difference just by switching out your oils that you're cooking with, and you'll start to see an improvement in your joints, your kids, everyone will just improve immensely. So one thing we want to get our patients into using are definitely going to be those oils such as avocado oil, coconut oil, and
olive oil.
Olive oil, yes, thank you.
That was olive oil. There was a seed in the background.
Yeah.
We're getting our facts out. Good. Go ahead and continue. Yes.
So when you switch those out, your body actually breaks things down differently when you have those unsaturated fats. So that's something that just another option that you have in that kitchen besides for making those smoothies. But like I said before, I'm all about quick, easy, simple. It's way easier to change your lifestyle when you have a whole team around you and when it's easy. You don't want to go out and make everything super difficult because the chances of you sticking to it aren't very high. So one thing we want to do is make sure that everything that we're giving our patients is easy to do and it's attainable for everyday life.
I'm very visual, so when I go to the kitchen, I like making my kitchen look like the cucina, whatever they call it in Italy, the cocina. And I have 3 bottles there, and I have an avocado oil one, I have the coconut oil one, and I have the olive oil right there. Big bottles. They make them real pretty, and they look Tuscan. And I don't care if it's an egg. I don't care. Sometimes even when I'm having my coffee, I got the coconut oil one, and I pour that one in and make myself a Java with coconut oil in it. So yeah. So go ahead. Sorry.
I was just going to say that's a great option too. I drink green tea and I also add coconut oil in that green tea just to help kind of boost everything and give my body another dose of those fatty acids that we want.
I got a question for you. When you have the coffee like that, when you have the oil in it, does it kind of lubricate your lips?
It does a little bit. So it's also added chapstick nutrients. Yeah.
It does. It's like, I don't need no lipstick. Okay, go ahead.
Yeah. I also have to stir it a little bit more just to make sure everything stays together. Right. Yes. And then another thing, just talking about things our patients can do when it comes to at home, There's tons of different options also with eating fish, increasing your good fish intake throughout the week. That's going to help also. And just because fish provides so many great things like omegas. And I know Astrid has also some more information on omegas.
I got a question before Rusty gets in there. Look, when we talk about carbohydrates, people, what's a carbohydrate? People say apple, banana, candy bars, and all that kind of stuff. People can rattle off carbohydrates for a day. Proteins, chicken, beef, whatever. They can rattle off. But one of the things I found that people have a difficult time is, what are good fats? I want 5. Give me 10 good fats for $1 million. Give me 10 good fats, like lard, like meat. No, this is why we're talking about, because the simple fats that we use, and we're going to add more to it right off the bat, is going to be avocado oil, olive oil. It is coconut oil. We can use things like butter oils, different types of margarines, and not margarines, but butters that are from grass-fed cows. We basically can we run out of creamers, non-dairy creamers, very specific creamers. Those we run out of it real fast. So it's like, what else is fat, right? And then we search for it. So one of the best ways to do it, we're not going to always put creamer on top of, or butter on top. Which, by the way, some coffees they put butter in it, and they blend it, and they make a real cool little Java hit. And everyone comes with their little ginger and oils and their coffee, and makes an espresso from heaven, right? So what else can we do? Go ahead.
We can, like I said, adding those fish in, which is going to help to give our bodies more of those omegas. And then we can also do more purple vegetables. Those are going to provide your body with more antioxidants. So that's definitely a good option too. When it comes to the grocery store, a rule of thumb that I love and I heard a long time ago is to don't shop in the aisles, is to try to shop on the edges. Because the edges is where you're going to find all that fresh produce and all those lean meats. It's when you start to get into those aisles, and that's where you're going to start finding, the cereal, those bad carbohydrates, those simple carbohydrates that the American diet has come to love but does not necessarily need.
The Oreos?
Yes, Oreos.
The candy, that aisle that every kid knows? Okay.
Yes. So that's just another great pointer. So when you come into our office, if you're suffering from metabolic syndrome or just anything in general, we really make your plan super personalized, and we give you so many tips, and we listen to your lifestyle, because what works for one person might not work for another. So we really make sure that we give you tips that we know you'll be successful with, and provide education, because that's another huge part of it.
All roads lead to the kitchen, huh?
Right. Yes.
Yeah, they do. Okay, so let's on specifically for the fats and the nutraceuticals. I want to also give you an idea as to what type of nutraceuticals are appropriate for us, because we want to be able to bust down these 5 issues affecting metabolic syndrome that we discussed. What are the 5, guys? Let's go ahead and start them up. It's high blood sugar, right?
High blood glucose.
High blood
yes. Low HDLs, which is going to be that good cholesterol that everyone needs and wants. And it's going to be the high blood pressure, which is, it's actually not considered high from a doctor's standard, but it is considered elevated. So that's another thing we want to make sure that this is metabolic syndrome, not metabolic disease. So if you go to the doctor and your blood pressure is 130 over 85, then that's an indicator. But yet your provider might not necessarily say your blood pressure is super high.
None of these disorders here by themselves are clinical states.
Right.
As a matter of fact, individually, they're pretty much just things. But if you have a combination of all these 5 together, you're in metabolic syndrome, and you feel like not too good.
Right.
Yeah.
Correct.
Yeah.
Another one is going to be the excess weight around the belly and the higher triglycerides.
Easy to see. You can see when someone has a belly that's hanging over like a fountain, right? So we can see that. There's you can go to sometimes Italian restaurants and you see the great cook, and sometimes, and I got to tell you, sometimes it's just, we're taught Chef Boyardee. He wasn't a thin guy. I think that Chef Boyardee, and the Pillsbury guy, right? It wasn't very healthy, right? He's like, both of them suffering from metabolic syndrome just from the outset. So that's an easy one to see. So these are the things that we're going to be reflecting on. Asti's going to go over some nutraceuticals, some vitamins, some food things that we can do to make things better. So here's Asti, and here's our head our science curator. Go ahead. Here's Steve. Go ahead.
Yeah. I guess before we get into the nutraceuticals, I actually want to make something clear. Like we were talking about metabolic syndrome. Metabolic syndrome is not I guess per se a disease or a health issue itself. Metabolic syndrome is actually a cluster of conditions, which can pretty much increase the risk of developing other health issues like diabetes, like stroke, like heart disease, it pretty much, because metabolic syndrome is not an actual, like, it's not a health issue itself. It's more so this group, this collection of other conditions, of other problems that can develop into much worse health issues. And because of that fact, metabolic syndrome has no obvious symptoms itself. But of course, like we were talking about, there are 5 risk factors, which are pretty much the ones we discussed about. Is the excess waist fat, the high blood pressure, high blood sugar, the high triglycerides, the low HDL, and according to healthcare professionals, to doctors and to researchers, if you have 3 out of these 5 risk factors, you have metabolic syndrome.
Yes, 3. Now, that doesn't mean that if you have it, you have symptoms, as Steve was very clear on. But I got to tell you, in my experience, when someone has more than 3, they're starting to feel crummy. They don't feel right. They just feel like, life's not good. They have just an overall, they don't look good, right? So, and I don't know them maybe, but their family knows that they don't look good. Like, mom doesn't look good, dad doesn't look good.
Yeah, and metabolic syndrome, like I said, it has no obvious symptoms, but as kind of going with one of the risk factors with waist fat. This is where you will see people with what you call the apple or pear-shaped bodies. They have excess fat around their abdomen, and although that's not technically considered a symptom, it is a factor that can give an idea to doctors or to other healthcare professionals that this person who is, they have prediabetes or they have diabetes and they have excess weight and obesity, they could have an increased risk of metabolic syndrome, and therefore developing, if it's left untreated, developing other health issues like heart disease and stroke. And I guess with that being said, then we'll get into the nutraceuticals.
I love this. We're getting some good stuff. We're getting some information.
And I guess with that being said, we'll get into the nutraceuticals. Kind of like how Kenna was talking about what's the takeaway? We're here talking about these health issues. We're here talking about metabolic syndrome today. But what's the takeaway? What can we tell people? Like, what can they take home about our talk? What can they do at home? So here we have several nutraceuticals, which I've written several articles in our blog, and I've looked and I've read.
Astrid? You think?
Yes.
I think that if you look at 100 articles that are written in El Paso, at least in our area, they were all curated by somebody, right?
Yes.
All right.
Yes. So we have several nutraceuticals here that have been they've been researched, and they've been researchers and all these research studies have found that they can help in some way and in some form improve metabolic syndrome and these associated diseases. So the first one I want to discuss is B vitamins. So what are the B vitamins? These are the ones that you can usually find as you can find them together. You can find them in the store. You'll see them as B complex vitamins. You'll see like a little jar, and then it basically comes with several of the B vitamins. Now, why do I bring up B vitamins for metabolic syndrome? So one of the reasons, researchers have found that one of the causes of metabolic syndrome could be stress. So with that being said, it's important for us to have B vitamins, because when we get stressed, when we have a hard day at work, when we have I guess a lot of, a lot of stressful things at home or with family, our nervous system will use these B vitamins to support our nerve function. So when we have a lot of stress, we will use up these B vitamins. And this stress, this increased stress, our body will produce cortisol, which is it serves a function, but we all know that too much cortisol, too much stress can actually be bad for us. It can give us it can increase our risk of heart disease.
As I remember, when we did this, all roads lead to the kitchen in terms of getting the food back in your body. All roads lead to the mitochondria. When it comes to the area of breakdown, the world of ATP production, energy production is surrounded, and it's wrapped around with things like nicotinamide, NADH, HTP, ATPs, ADP. All these things have a connection with vitamin Bs of all sorts. So the vitamin Bs are at the engine and the turbine of the things that actually help us. So it makes sense that this was the top of the vitamin and the one that is the most important. And then she's got some other points here on niacin. What have we noticed with niacin? What have you noticed there?
Well, niacin is another. It's a B vitamin. There's several B vitamins. That's why I have it there under its plural. And niacin, or vitamin B3, as it's more well known, a lot of research studies have found that taking vitamin B3, it can actually help lower LDL, or bad cholesterol, and it can help lower triglycerides, and it could increase HDL. And several research studies have actually found that niacin, specifically vitamin B3, can help increase HDL by 30%.
Incredible. Niacin is the when you look at NADH, these are the N is the niacin, the nicotinamide. So in the biochemical compound. So niacin is the one that people have known that when you take it, the good one, or the one that's supposed to be, you get this flushing feeling, and it makes you scratch all your part of your body, and it feels good when you scratch because it makes you feel that way. Right? So niacin is huge.
Yes, and also I just wanna highlight a point about B vitamins. Like, B vitamins themselves are important because they can actually help support our metabolism. When we eat, carbohydrates and fats, good fats, of course, and proteins. When we go through when the body goes through the process of metabolism, it converts the carbohydrates, the fats, and the proteins into energy. And B vitamins are actually one of the main components that are in charge of doing that.
Latinos, or in our general population, we know that we have always heard of the nurse or the person who gives vitamin B injections. Have you heard of those things, right?
Yes.
Right? Because you're depressed, you're sad. What they would do, well, you know what? And inject them with B12, right?
Yes.
Or the B vitamins, right? And the person would come out like, yeah, and then be excited, right? So we've known this. This was the elixir of the past. Those traveling salesmen, the people that had the potions and lotions, they made a living off of giving B vitamin complex. As a matter of fact, the first energy drinks were first designed with a B complex, packing of them. And now here's the deal. Now that we've learned that energy drinks cause so much issues, we're headed back to the B complexes to help people better. So the next vitamin we have there is which is that one? We have the D. We have the D, vitamin D.
Yeah, the next one I wanted to talk about is vitamin D. There's several research studies on vitamin D and the benefits of vitamin D for metabolic syndrome, and just how I discussed before about how B vitamins are beneficial for our metabolism. Vitamin D is also helpful for our metabolism as well, and it can help regulate our blood sugar, essentially our glucose, and that in itself is very important because, like, one of the predisposing factors of metabolic syndrome is high blood sugar. And if you have uncontrolled high blood sugar, it can lead to it can lead to pre-diabetes, and if that is left untreated, it can lead to diabetes. So research studies have also found that vitamin D itself can also improve insulin resistance. which is pretty much one of the things that can lead to diabetes.
You know, I just want to pull out vitamin D is not even a vitamin, guys. It's a hormone. It was discovered after C by Linus Pauling. Once they discovered it, they just kept on naming them the next letter. Okay, so since it is a hormone, you got to just practically look at it. This particular vitamin D or this hormone, tocopherol, it basically can change so many metabolism issues in your body. I'm talking about literally 400 to 500 different processes that we're finding. Last year was 400. We're now almost 500 different biochemical processes that are actually affected directly. Well, it makes kind of sense. Look, our biggest organ in the body is our skin. And most of the time we ran around in kind of skimpy clothes and we were in the sun a lot. Well, it wouldn't stand to reason that that particular organ can produce the greatest amount of healing energies, and vitamin D does. It gets produced by the sunlight and activated. But today's world, whether we're Armenian, Iranian, different cultures in the north, like Chicago, people don't get as much light. So depending on cultural changes, depending on clothes, and people live and work in these fluorescent lights, we lose the essence of vitamin D and we get very sick. The person who takes vitamin D is a much healthier person. And our goal is to raise that vitamin D. It's a fat-soluble vitamin and one that embeds itself by and saved in the liver along with the fat in the body. So you can raise it slowly as you take it, and there really isn't. It's very difficult to get toxic levels, but those are at about 125 nanograms per deciliter that are too high. But most of us run around with 10 to 20, which is really low. So in essence, by raising that, you're going to see that the blood sugar changes are going to happen that Astrid's speaking about. What other things have you noticed about particularly vitamin D? Anything?
No, I'll get back to vitamin D in a bit. I actually want to discuss some of the other nutraceuticals first.
Okay.
But pretty much vitamin D, it's beneficial because it helps improve your metabolism and it helps improve your insulin resistance, at least towards metabolic syndrome.
How about calcium?
Calcium. So calcium goes hand in hand with vitamin D, and the thing that I wanted to talk about with vitamin D and calcium together actually is that we often think about these 5 factors that we mentioned before that could cause metabolic syndrome, but there's actually if you really want to think about it, like what are the underlying causes for a lot of these risk factors, and obesity, a sedentary lifestyle, people who don't engage in exercise or physical activity. One of the things that can predispose a person or pretty much increase their risk of metabolic syndrome is what if this person? Let me put the scenario. What if a person has a chronic pain disease? Mm-hmm. What if they have something like fibromyalgia? They're constantly in pain. They don't want to move, so they don't want to exercise. They don't want to aggravate these symptoms. So sometimes there's people that have chronic pain and they have things like fibromyalgia, or even let's go a little bit more basic. Some people just have chronic back pain, and you don't want to work out. So just you're not choosing. Like some of these people aren't choosing to be inactive because they want to. That some of these people are legitimately in pain, and there's several research studies. This is what I was going to tie in vitamin D and calcium with. That vitamin D and calcium, you can take them together. They can actually help improve chronic pain in some people.
Incredible. And we all know that calcium is one of the used cause for muscle spasms and relaxers. Tons of reasons. We're going to go into each one of these. We're going to have a podcast on just vitamin D and the issues and calcium, because we can really, really go deep. We're going to go deep. We're going to go all the way to the genome, which is basically the genomics, which is the science of understanding how nutrition and the genes dance together. So we're going to go there, but we're kind of like we're penetrating slowly in this process because we have to take the story slowly. What's up next?
So next we have omega-3s, and I want to specifically highlight that we're talking about omega-3s with EPA, not DHA. And so these are EPA, which is the one that's listed up there, and DHA. They're two there are two important types of omega-3s essentially. They're both very important, but several research studies, and I've done articles on this as well, have found that I guess taking omega-3s specifically with EPA, it's just more superior in its benefits than DHA. And when we talk about the omega-3s, these can be found in fish. This is most of the time, if you want to take omega-3s, you see them in the form of fish oils. And this is going back to what Kenna discussed before, like following a Mediterranean diet, which is it mainly focuses on eating a lot of fish. This is where you get your intake of omega-3s. And research studies have found that omega-3s themselves, they can help promote heart health, and they can help lower bad cholesterol, your LDLs, and these can also improve metabolism, just like vitamin D.
I want to go ahead and blanket all these things under the fact that we're also looking, and when we're dealing with metabolic syndrome, we're dealing with inflammation. Inflammation and omegas have been known. So what we need to do is we need to bring out the fact that omegas have been in the American diet, even in a grandma's diet. And like, again, we hear back in the day when grandma or great grandma would give you cod liver oil. Well, the highest omega carrying fish is the herring, which is at about 800 milligrams per serving. The cod is actually the next one. It's around 600, but because of the availability, the cod's much more available in certain cultures. So everybody would have cod liver oil, and they'd make you close your nose and drink it. And they knew that it had a correlation. They would think it's like a lubricant, but actually it was an anti-inflammatory, specifically with people, and usually grandmas who knew about this, right? Helps with the intestines, helps with inflammation, helps with the joints, and they knew the whole story behind that. So we'll go deep into the omegas in our later podcast. We have another one that's here. It's called berberine, right? What's the story on berberine?
Well, pretty much the next set of nutraceuticals that are listed here, berberine, glucosamine, chondroitin, acetyl L-carnitine, alpha-lipoic acid, ALA, ashwagandha. Pretty much all of these have been tied into what I talked before about chronic pain and all of these health issues. I listed them up here because I've done several articles, and I've read a variety of research studies that have covered these in different trials and in different research studies with different participants, and these have pretty much found this group of nutraceuticals here that are listed. These have also have been tied in to help reduce chronic pain, and since, like I discussed before, because chronic pain, people who have fibromyalgia, or even let's go a little bit simpler, people who have back pain, these people who are inactive, who have sedentary lifestyles, simply because of their pain, and they can be at risk of metabolic syndrome. A lot of these research studies have found that these nutraceuticals themselves can also help reduce chronic pain.
The new one, I think, is called alpha-lipoic acid, acetyl L-carnitine. We're going to have our resident biochemist on the following podcast go deep into these. Ashwagandha is a really interesting name. Ashwagandha. Ashwagandha. Say it again. Kenna, can you tell me a little bit about ashwagandha and what we've been able to discover about ashwagandha? Because it really is a unique name and a component that we do look at. And we're going to talk about more. We're going to get back to Asti in a second, but I want to give her a little break and kind of let Kenna tell me a little bit about ashwagandha.
I was actually going to add in something about that berberine.
Oh,
first.
Let's go back to berberine. Berberine. These are berberine, and ashwagandha. Okay.
So that berberine has also been shown to help decrease the HbA1c in patients who have blood sugar dysregulation, which is going to come back to the whole prediabetes and type 2 diabetes situations that can occur in the body. So that one has been shown to decrease that number.
to stabilize the
wanted
blood
to
sugar.
add that
So,
in. Yes.
so yeah, no. It's berberine is. There's a whole thing we're going to have on berberine, but one of the things that we did in terms of metabolic syndrome, it was one to definitely make the top list here for the process. So there's ashwagandha and berberine. So tell us a little about ashwagandha. Also, the ashwagandha is the one that's okay. So, in terms of the blood sugar, the A1C is the blood sugar calculation that tells you exactly what the blood sugar does over a period of about 3 months. The glycogenation of the hemoglobin can be measured by the molecular changes that actually happen within the hemoglobin. That's why the hemoglobin A1C is our marker to determine. So when ashwagandha and berberine come together and we use those things, we can actually alter the A1C, which is the 3-month kind of like a historical background of what is actually going on. We've seen changes on that, and that's one of the things that we do. Now, in terms of the dosages and what we do, we're going to go over that, but not today because that's a little bit more complex. Soluble fibers have been also a component of things. Now, when we deal with soluble fibers, why are we talking about soluble fibers? First of all, it is food for our bugs. So we got to remember that the probiotic world is something we cannot forget. People need to understand that that probiotics, whether it's the lactobacillus or bifidobacter strains, whether it's small intestine, large intestine, early on the small intestine, there's different bacteria all the way to the very end, and to the cecum, to the back end. So let's call that the place that things come out. There's bacteria everywhere at different levels, and each one has a purpose. So we can discover that. There's vitamin E in green tea. So tell me a little bit about Astrid, about this dynamics in terms of green tea. What do we notice as it pertains to metabolic syndrome?
Okay, so green tea has a lot of benefits, but, there's a lot of people that are like, some people don't like tea. Some people are more into coffee, but if you do want to get into drinking tea, because of its health benefits, definitely green tea is a good place to start. And in terms of metabolic syndrome, green tea has been demonstrated to help improve heart health. It can help I guess lower and it can help lower these risk factors that pertain to metabolic syndrome. It can help several research studies that have found that green tea can help lower cholesterol, bad cholesterol, LDLs.
Does it actually does the green tea help us with our belly fat?
Yeah. There's one of the benefits of green tea that I've read about. Pretty much one of the ones that probably that it's most well known for is that green tea can help with weight loss.
Oh my gosh! So basically, there should not be. I mean, water and green tea. That's it, guys. That's all. That's it. We limit our lives to that.
Yeah.
It's also. I mean, we forgot even the most powerful thing. It takes care of those ROSs, which reactive oxygen species, which is our antioxidants or oxidants in our blood.
Yes.
So it just basically squelches them and takes them out and cools their cool and actually prevents the normal deterioration that happens, or the excessive deterioration that happens in the breakdown of normal metabolism, which is a byproduct, which are ROS, or reactive oxygen species, or wild, crazy oxidants, which we have a neat name for the things that squelches them and calms them and puts them in the order. They're called antioxidants. Mm-hmm. So the vitamins that are antioxidant, A, E, and C, are antioxidants too. So those are very powerful tools that we deal with as we lower our body weight. We free up a lot of toxins. And as the green tea goes in there, it squelches them, cools them, and gets them out of, guess where? The other organ that basically helps with the whole insulin production, which is the kidneys. The kidneys are flushed out with green tea, and that also helps. I noticed that one thing that you really haven't done, Astrid, is done articles on turmeric, right?
Oh, I've actually done a lot of articles on turmeric and curcumin.
I know.
There, from the list that's up there, turmeric and curcumin is probably like one of my most favorite nutraceuticals to talk about. Yeah,
we catch her over there gnawing on a root every couple of times.
Yeah, I have some in my fridge right now.
Yeah, you touch that turmeric, you're going to lose a finger. What happened to my finger? You got near my turmeric, right? The root, right? So tell us a little bit about the properties of turmeric and curcumin in terms of metabolic syndrome.
Okay. I've done several, a lot of articles on turmeric and curcumin, and we've also discussed it before in several of our past podcasts. And turmeric is that it's that yellowish. It could look orange to some people, but it's usually referred to as a yellow root, and it's very popular in Indian cuisine. It's one of the main ingredients that you'll find in curry. And curcumin. Pretty sure some of you people have heard curcumin or turmeric. What's the difference? Well, turmeric is it's the flowering plant. It's the root. We eat the root of turmeric, and curcumin is just the active ingredient in turmeric that gives it gives it the yellow color.
Guys, I will not let anything but the top type of curcumin and turmeric products be available to our patients, because there's a difference. There's certain ones that are actually produced with literally, I mean, we got solvents, and with the way we get things out and of curcumin and turmeric, or even things like cocaine, is you have to use a distillate, okay? And whether it's water, acetone, benzene, okay, or some sort of a byproduct. We know today that benzene is used to process many types of supplements, and certain companies use benzene to get the best out of turmeric. The problem is benzene is cancer producing. So we got to be very careful which companies we use. Acetone, imagine that. So there's processes that are in place to extract the turmeric properly and that are beneficial. So finding the right turmeric, all turmerics are not the same. And that's one of the things that we have to assess. Since it has so many products, the world is running real crazy to try to process turmeric. And specifically, even if it's the last thing that we're discussing today on our subject matter, but it's one of the most important things. Today, we don't even understand aspirin. We know it works, but the total magnitude of it is yet to be told. However, turmeric is in the same boat. We're learning so much about it that every day, every month, studies are being produced on the value of turmeric into the natural diet. So Astrid she's in tune in on target on that. So I'm sure she's going to bring more of that to us, right?
Yes, of course.
Okay. So I think what we can do today is, when we look at this, I'd like to ask Kenna, in terms of when we look at a metabolic syndrome from the presentations of symptoms or even from laboratory studies, the confidence of knowing that N equals 1 is one of the most important components that we have now in functional medicine and functional wellness practices that a lot of physical medicine doctors are doing in their scope of practice. Because in metabolic issues, you can't take metabolic away from the body. Does metabolism happen in a back problem? We notice that there's a correlation with back injuries, back pain, back issues, chronic knee disorders, chronic joint, musculoskeletal disorders, and metabolic syndrome. So we can't untease it. Tell us a little bit about, Kenna, as we close out today, a little bit about what a patient can expect when they come to our office and they get kind of put in the, oops, you got metabolic syndrome. So boom, how do we handle that?
We want to know their background because, like you said, everything is connected. Everything is in depth. There's detail. We want to get to know it all so we can really make that personalized plan. So one of the first things we do is a very lengthy questionnaire by Living Matrix, and it's a great tool. It does take a little while, but it gives us so much insight on the patient, which is great because it allows us to really, like I said, dig deep and figure out, traumas that might have happened that are leading to inflammation, which, how Astrid was saying, then leads to that sedentary lifestyle, which then leads to this metabolic syndrome, or just kind of down that road. So one of the first things we do is we do that long questionnaire, and then we sit down and we talk to you one-on-one. We build a team. We make you part of our family because this stuff isn't easy to go through alone. And so the most success is when you have that close-knit family and you have that support, and we really try to be that for you.
We have taken this information and realized it was very complex. Prior to about 5 years ago, it was very difficult. 300-page questionnaire. Today, we have software that we can figure out. It is backed by the IFM, the Institute of Functional Medicine. The Institute of Functional Medicine, it had its origin over the last decade and become very popular understanding the whole person as an individual. You can't separate an eyeball from kind of the body, as you can't separate a metabolism from all effects that it has. From once that body and that food, that nutraceutical, that nutrient enters our body, on the other side from our mouth is these little waiting things called chromosomes. They're spinning and they're churning, and they're creating enzymes and proteins based on what we feed them. In order to find out what's going on, we have to do an elaborate questionnaire that brings in mental, body, spiritual. It brings in the mechanics of normal digestion, the way that the integument works, the way that the overall living experience happens in the individual. So when we take consideration, Astrid and Kenna, together, we kind of figure out the best approach, and we really have a tailor-made process for each individual person. We call it the IFM 1, 2, and 3, which are a complex series of questions that allow us to give you a detailed assessment and a true breakdown of where the cause can be at. And along with the nutraceuticals and the nutrients that we focus on, we push you right directly to the place where it matters, into the kitchen. And we end up teaching you and your family members how to feed so that you can basically be good to those genetic genomes, which your, as I always say, ontogeny recapitulates phylogeny. We are who we are from the past of the people, and those people have a thread between us and my past, as well as everyone here's past, and that is our genetics. And our genetics responds to the environment. So whether it goes in the south really fast or exposed or predisposed, we're going to discuss those, and we're going to enter the world of genomics soon in this process as we go deeper in the metabolic syndrome process. So I thank you all for listening in on us. Know that we can be contacted here, and they're going to leave you the number. But we have a state here that's doing a researcher. We have a team that is established by a lot of individuals that can look out and give you the best information that applies to you, N equals 1. We got Kenna here that is always available, and we're here taking care of people in our little beautiful town of El Paso. So thank you again, and look forward to the next podcast, which will be probably within the next couple of hours. Just kidding. All right. Bye, guys.